Good morning and welcome to launch of Change for Good Health, a blueprint for change. I'm Holly Dunn. I've been working closely with David Patchell-Evans, who you'll see on the screen. He's a major supporter of physical activity for kids with autism and special needs and a fitness leader, and social change consultants Impact to launch this initiative. I'm going to be emceeing the event today. I want to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we're meeting on a virtual platform, I want to take a moment to acknowledge the importance of the lands, which we each call home. We do this to reaffirm our commitment and our responsibility in improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people and who call this land home. I want to recognize the harms and the mistakes of the past and to consider how we are and can each in our own way try to move forward in a spirit of reconciliation and collaboration. We are delighted that most, if not all, of the participants who took part in Change for Good Health are here in the audience today. And we have a number of participants sitting on our panel. I also want to welcome others to the event, including members of the media. As we move through today's panel discussion, I invite you to submit any questions you have for our panelists using the Q&A button at the bottom of your Zoom window. We'll be able to pose some of these questions to our panelists during the live Q&A portion at the end of the panel. So feel free to address it to any specific panelists. All of them are interesting. And please remember that they won't be answered until the end, and we'll try to do what we can, but we can only answer some of the questions depending on time. Change for Good Health is a coalition of organizations and experts that's looking to make access to physical activity a right for everyone in Canada, especially marginalized communities and vulnerable populations. Organizations taking part in Change for Good Health include Ability Centre, Boot Camps for Change, BGC Canada, Canadian Coalition for Seniors Mental Health, Canadian Tire Jumpstart Charities, Canadian Women in Sport, CanFit Pro, Diabetes Canada, Exercises Medicine Canada, Good Life Fitness, Good Life Kids Foundation, Heart and Stroke, Jay's Care Foundation, MSLE Launchpad, Move to Live More, Right to Play, and Unsinkable. Just a short list. Academic and medical experts include Dr. Gordon Asmundson, who's from University of Regina, Dr. Paul O with University Health Network, Dr. Nicole Koulos-Reed, who's University of Calgary, and Dr. Iris Lesser, who's University of Fraser Valley. Dr. Bruce Kidd is also here with University of Toronto, among others. Our goal with Change for Good Health is to pull together existing research, programs, and experiences and gather additional input from health, academic, community groups, fitness, sport, and recreation to find ways to make physical activity something everyone can access for their health. Change for Good Health participants met earlier this year to share research related to physical activity and health, as well as lessons learned and best practices for delivering programs to vulnerable communities. They plan to regroup in the coming weeks to identify and pursue collaboration opportunities and innovative ways to create new projects and improve existing ones. I'm going to introduce David Patchell-Evans, or as Patch, as most people call him. Patch has been concerned about the health of Canadians since the pandemic started, and in the 42 years before that. He partnered with Impact to establish Change for Good Health with the goal to make access to physical activity a right for everyone. I'd like to invite Patch to say a few words.
Thanks very much, Holly. Good morning, everybody. You know, it's a real honor to have everyone here. I'm so pleased that together we get to release the Change for Good Health discussion paper today. I see this as a way that we all can help more people in Canada take care of their health through physical activity. I actually believe Canada could be the healthiest country in the world. We just need to change how we think about physical activity. It's not optional to exercise for your health. It's totally essential. It's always been my mission to give everyone a chance to experience the incredible benefits of exercise. I believe the ability to be allowed to access fitness should be a right for everyone. In Canada, our inactivity rates scare me. COVID has made this problem so much worse. Inactivity is a crisis. It's urgent that we allow people to take care of their health and wellness. Our options to be physically active have been radically reduced during COVID. I hope as a collective, we can ensure access to physical activity. We can't afford to wait. Our health, everyone's health, depends on it. Thanks very much. Back to you, Holly.
Thanks, Patch. Now, I just want to introduce you to our esteemed panel members, all of whom were part of the Change for Good Health from the start. We have Marco de Buono, who's an Associate Vice President of Operations and Programs with Canadian Tire Jumpstart Charities. Laura Mcphie is here. She's the Training Manager with Right to Play. Joel Dembe is a Canadian Paralympian and Rick Hansen Foundation Ambassador. Dr. Paul O is here. He's Medical Director of the Cardiovascular Prevention and Rehabilitation Program at the Peter Munk Cardiac Center and Toronto Rehab Institute. Takes a while for him to do his elevator pitch. Justin Bobb, Director of Equity, Diversity and Inclusion, Team Strategy with MLSE. He's also with Toronto Maple Leafs, Toronto FC, and Toronto Argonauts. Amanda Sterczyk, who's the Manager of Health Research and Policy Analysis with Diabetes Canada. And Dr. Iris Lesser is here, Professor of Kinesiology, University of the Fraser Valley. Now, I'm going to turn the floor over to Paul Klein, CEO of Impact, who will begin moderating our discussion. Over to you, Paul.
Thank you, Holly, and welcome everyone to this incredible session. It seems like just not too long ago, Patch and I had a conversation, I guess it was before Christmas, about what he was saying earlier, which is how and why in a country like Canada, too many people do not have access to physical activity, and fitness actually is not a right for enough people in this country. And framing this also, is the fact that the United Nations Sustainable Development Goal number 3 focuses on physical activity, yet here in this country we're too far away from it. So this is how this whole thing started. What do we do to make a difference and actually move the needle? And since then, first of all, we appreciate the collaboration of everyone who's on the panels that we had earlier this year. They were incredible for everyone, for me and Patch and everyone that was involved. It was just, it was so remarkable to see all of you and sharing ideas, and that was sort of the first action that was taken. Also I just wanted to acknowledge the incredible collaboration of Holly and her team and our team at Impact, and everyone's input into creating this, what we're now calling a blueprint for Canada in terms of taking action in this area. So thank you to everybody. For people who haven't yet seen the actual blueprint, there's 6 areas that were flagged by the participants as being key goals for change, and I'll just go through them for people who haven't seen them. Number 1 is incentives and cooperation in the physical activity sector. So that's more collaboration between people like the folks who participated in Change for Good Health and everyone else involved in this sector. Number 2 is democratizing physical activity. As I said, the challenge is that this is not a right today, and this group believes it ought to be and must be. Number 3 is making activity welcoming. One of the things that we all talked about, and which is true, is that it's not enough people actually feel safe and comfortable when they're in a physical activity situation. Number 4 is relevant and relatable physical activity. And a lot of this has to do with kind of an underlying theme here, which is that not enough people who are vulnerable people, or those now outside the physical activity space, are actually involved in developing programs which they could participate in. And that's not good enough. Number 5 is training the trainers. Those are the folks that are actually delivering physical activity programs, and there's a lot more that they can be doing in terms of their own understanding of things like, the impact of mental health during the pandemic and otherwise on trainers themselves, and also people who are being trained. And then finally, the number 6 is starting early and making health literacy as important as any other subject, really. So just to kick things off, I would love to get input from each of you from your own perspectives in terms of these 6 different priority goals that have been established. Which one, if you had, I know it's hard to do because they're all connected to each other, but if you had to pick one to start with, I'd love to hear about what that would be and why that's so important in your context. Iris, how about, I'll turn it over to you.
Sure, get me off and running. Thanks for the introduction and thanks for putting this all together. I would say that, well, there's 2 that I kind of sit on. One would certainly be democratizing physical activity, and I look at that from particularly a clinical standpoint. So individuals who have chronic conditions, have clinical conditions, do we have opportunity for them to engage in safe physical activity, both indoors and outdoors? So number 2 there, as well as number 4, which is relevant and relatable physical activity. At our panels, I talked about a couple of different groups that I work with, and right now we're running a project with postpartum women and looking at sort of how these different groups really require different types of physical activity programs that are both appropriate and doable. So being able to bring children, babies with you to physical activity is a big piece of it as well. So I'll kick it off with those 2.
Right. Thank you. Justin.
Thanks. It's a great question. I can't say all, right, Paul? I'll go with number 4 as well. I think the word relevance strikes me when you think about, you know, the lack of equity in our systems and the cultural expense of physical activity, because we talk a lot about the cost factor, which is true, but I think to Iris's point, the cultural relevancy of me wanting to participate is probably the place for us to start across the country.
Great, thank you. You know, one thing I'll just, another part of this question that I'll add on to it, just to, sometimes it's kind of abstract for a lot of people, you know, and we're talking about these ideas, but one of the things that maybe the people who are listening didn't have the benefit of is actually listening to some of the examples. So when you're actually sharing these things, if you could actually point to any specific example within your own context that people could actually kind of wrap their minds around it. So Justin, anything specific that comes to mind for you about why number 4?
Yeah, I think about my parents, and my parents are immigrants from Guyana, and you know, my mom gets to this country and her GP is like, you need to be physically active, and she has no frame of reference for what that means, and running on a treadmill is not something that would make sense to her. So I think I starts at home for me, right? And I think about my own parents wanting me to be safe and healthy, but not understanding the intersection of sport and physical activity in my life to help me on that journey.
Great, thank you. Laura.
Hi. So I work with Right to Play, and it was pretty easy to pick one of these ones that we really focus on, which is train the trainer. That is really what our model is. And I think that train the trainer really allows you to access some of the other spaces as well. And I'll give an example for sure. So I work specifically with our Indigenous programs. I'm Indigenous myself. I'm from Pikwakanagan First Nation. And so the history of sport, way back before colonization, we had our own sports and movement and physical activity, and it was a huge part of our life and the way we interacted with the world. And then while colonization was happening, it was often used as a weapon against us, as a way of attacking us, our bodies, taking space away from our land, and also a view of kind of civilizing us. So it's a very complicated area to be in, but what we do with Right to Play is we partner with communities to train local youth workers. And so we provide scaffolding, and I'll bring this to a specific in a second, but we provide training scaffolding, how to create safe space, how to address mental health within your community, how to run safe programming. And that lets us get to a lot of the other pieces like locally specific and contextual, making sure that it's welcoming and relevant and democratic as well. And an example of this that we just did was a gender equity project So we did a pilot project, which was really fun, that targeted both boys and girls, because research was saying that like girls can't change their spaces alone. They need allies in the space. So what we did is we provided training to local youth workers who selected the sport that they wanted to do based off of youth wants. We trained them around gender equity and the issues around gender equity, how to create safe spaces for girls, how to create safe spaces for boys to talk about difficult topics. And then we built a sport program around it, physical activity program around it, where they had deep conversations about gender equity around sport. And those conversations were led by someone who was local, someone who was trusted, someone the youth could approach and have these conversations with. And so that really allowed there to be success in the programming. And that's what we mean by training the trainer, is that we're not necessarily teaching them like, do this, do that. We're building their capacity to understand what is relevant to them and how to build their own program. So that's really what I think the one I'm most excited about is train the trainers.
Yeah, thanks for saying that, Laura. Again, your points reinforce what, one of the commonalities here, which is really turning to the people with the lived experience all the way through and reflecting programs, developing programs that based on their needs and experience, not having enough today. Joel, over to you.
Well, I think for me, there's 2 points. Among our 6 goals for Change for Good Health here. Obviously, the second, democratizing physical activity, specifically around accessibility, is something that completely resonates with me. I grew up with a disability. I have the lived experience of not being included in activities with the rest of my classmates. I have the lived experience of spending 3 or 4 years not able to participate in gym class simply because of the rigid lines of gym class here in Ontario. But I do think that activity is a human right. We talk about accessibility a lot, especially right now, as next week is National Accessibility Week here in Canada. And among the most prescient of issues impacting people with disabilities in Canada right now is lack of access to opportunities to stay healthy, to stay fit. And I could go on, but I am the embodiment of someone who thrived because I was given those opportunities to be included, to find a teacher that welcomed me. And that's obviously number 4 or number 3, making activity more welcoming. 15% of Canadians have disabilities. Many Canadians are aging and as a result acquiring disabilities. So we do need to democratize health and fitness and ensure that Canadians have every right to stay healthy, especially given that there's so many obstacles right now, and especially COVID-19 has widened the gap. And I hope we can all solve this together.
Thanks for saying that, Joel. And I can't remember if during the sessions themselves, it was you who said this or someone else, but one of the things we talked about was some of the who are the folks who are most impacted by lack of activity during COVID, and the disability community came up, and someone came to the picture of people literally landlocked in their houses and apartments, not being able to get out.
Absolutely, Paul. And I think the misnomer has been we've labeled it as a long-term care issue, as an issue impacting older Canadians. That's wrong. These are issues impacting people with disabilities. People with disabilities are our family members, friends. They're me. So I'm very cognizant of the last year and the fact that many are cut off from simple rehabilitation activities, heading to the gym, me included. It is something that I think we seriously need to address as we're ramping up our vaccine efforts across Canada.
Thanks, Joel. Amanda.
Hi there, I'll just put my camera on for a moment. So much of what the other panelists have said, really resonates with us at Diabetes Canada. In terms of the goals, I would say that the key ones are, democratizing physical activity and relevant and relatable physical activity. Part of our national diabetes framework strategy, D360, has a target of 90% of all Canadians living in communities and environments that promote wellness. And this includes physical wellness, as well as its relation to mental and emotional wellness. As well, we recently released our built environment policy position, looking at communities to ensure that individuals have the ability to be physically active as part of their activities of daily living, that the infrastructure is in place so that, you know, they're in walkable communities that are safe, with lighting, with sidewalks that people with varying levels of abilities can access. They have public transportation available. We know that if people are commuting by bus, they can achieve a lot of their goals around daily physical activity, just being able to move to and from bus stops in their community if it's safe for them. As well as in rural, remote, and northern communities, we want to ensure that the environment and the infrastructure is in place for people to be physically active without needing to have a gym membership or expensive equipment, that it's part of their daily life. And we do know from our CDPP, which is the Canadian Diabetes Prevention Program, was modeled after the very successful program in the US and in Europe that looks at helping people prevent type 2 diabetes or prediabetes, and involves healthy behaviors, physical activity, targeted weight loss between 5 and 7%, and access to a health coach. And the early results from the Canadian Diabetes Prevention Program show that 56% of participants that had their A1C, basically their 3-month check of blood sugar level in the prediabetes range at baseline, were no longer in the prediabetes range after 12 months of program participation. So we know that physical activity is a healthy behavior that helps reduce the risk of developing type 2 diabetes, and it also helps with managing complications for people living with type 1 and type 2 diabetes. Thanks.
Thank you, Amanda. And I feel like Dr. O, I was going to ask you the same question, but I think a lot of this is leading to you in a lot of ways. The program that you run in terms of cardiovascular health, a lot of the things like Amanda was saying and some of the others are resulting in problems that you see every day. So I have 2 questions for you, but the first one is, again, of the goals here, if you could pick one from your point of view in terms of having a positive impact on your work, is there one that you think is particularly important?
Thanks, Paul. And I really appreciate the comments from our colleagues that have been so insightful in painting a landscape for us. I'm deviating, Paul, and going with 4, 5, and 1. So 3 answers instead of 1, but it builds on a system of the stories of persons with lived experience, bringing in a provider angle and also bringing in a system level around healthcare transformation and changing for good. We've already heard that people with lived experiences living with various conditions, disabilities, need the opportunities to get into physical activity in their own way that is safe. Too often we'll say that if you have a condition, like in my world, you've had a heart attack, well, then maybe you shouldn't be active. So then the opposite is, let's be sedentary for the rest of our lives, which is a terrible trajectory and destination. We know that's not going to turn out well, but we can develop appropriate solutions together. Which brings me to the second point, that providers, we've talked about train the trainers, but train the healthcare practitioners as well around acknowledging the importance of physical activity, and get comfortable with even introducing the conversation. Hey, I've got a great kinesiologist for you to meet who can provide some great advice. And then the third thing is, if all this is working in a good system, where healthcare and physical activity centers or systems are integrally connected. So medical care equals healthcare, not sickness care. And we can develop opportunities for everybody deserving of it, and that's everybody, to get active as part of their medical plan. Love the blueprint and how we can all find ways of advancing the agenda.
Thanks. Thank you, Dr. O. The other thing that I was thinking of as you were chatting here is one of the most, I don't know, sort of really shocking findings, honestly, is that the World Health Organization recommends 150 minutes of activity a week. And Canada is sadly far behind this, in spite of years of programs and funding and, well-meaning organizations and so on. Why are we so far from that? What seems like a very achievable number for Canada? Dr. O, if you just want to continue on that.
Sure. A couple thoughts on that. One, absolutely, we have ways to go. And why are we there? I think all of our colleagues on the line would be able to identify something with the person, a system, the environments, incentives, barriers that all contribute to this perceived gap or this real gap of people being active, and the elements that are highlighted in Change for Good to change this are so critically important, so we can make being active the easy thing. The other point that I think many of our panelists would like to make as well, though, is that 150 is a reasonable number to put on the table, but it need not be the be all end all, of course, that whatever level of activity, movement, not being sedentary through to exercise are good positive steps. So perhaps our obsession with 150 may be a bit misplaced, and it's wherever you are, if you can just move a little bit more, then that's going to have a major impact. So let's not lose that as an important proximal goal for us.
Mm-hmm. Thank you, Doctor. Anyone else want to jump in on that gap, the 150 gap, what you're seeing?
I really like. Oh, sorry.
Go ahead, Laura.
I really like what Dr. O just said, which is we need to change, and we mentioned it in the report, that we need to change the way people view physical activity. I was having a conversation with someone once, and they were like, well, how do I plan physical activity into this youth program? And I'm like, you already do it. You went berry picking with them the other day. Well, the berry picking involved walking, it involves standing, bending, crouching down, standing up, a lot of physical literacy pieces. And that was a moment where the woman I was talking to just had this epiphany of like, oh, physical activity is so many different things. And so I think it's not just get to 150 of like intense working out, but instead reframing what physical activity is so people find it accessible.
Mm-hmm. Thank you. Anyone else? I can't remember who was going to say. Amanda.
Yes, that's okay. So I think it's the reframing and the not confounding physical activity and exercise. All exercise is physical activity, but not all physical activity is exercise. And if we can work towards having people be less sedentary, like nudging them to get up off the couch and, engage in activities of daily living, which are, a component of physical activity. Every minute of movement counts. So we need to encourage people to just get up and move more, as opposed to get out there and do 150 minutes.
Sure, thank you. Iris.
I would also just add that we somewhat need to recognize how far behind we are in terms of statements like 150 minutes from what we know from research. So there's been lots of research that has shown that even 5 minutes of physical activity starts to have a positive metabolic effect. So while 150 minutes is where the broad research has come from, and that's where we've been sitting for a while, things have changed and shown us how important just little bits over time is. So recognizing that, well, 150 minutes is great. We actually do have research that says that little bit does count. So not just from a get moving standpoint, but also a science standpoint.
Thank you. And Marco, I missed you the first time round. I realized I was looking at you and I thought I haven't heard from him. But
no worries, Paul. No worries, Paul. So yeah, I think a couple of things. I mean, obviously I've got a huge affinity for all of the recommendations, because at their core, they actually articulate a lot of the known disparities and a lot of the known barriers to participation. So they're a pretty good summation of all the great work that everybody on this panel and all the participants, have spent a career trying to advocate for. I'm not going to repeat what others. Number 4 is definitely one of my top, without question, because of that participant-centered notion. But I'm going to go with number Number one, the partnerships. And the reason for that is, Paul alluded to this, Amanda alluded to this, Laura, look at the diversity of organizations that are represented on this panel. Sport, physical activity, and recreation is a real ecosystem of different entities at the grassroots level that should be brought together to provide those participant-centric opportunities for people to engage as they see fit, when they see fit, how they see fit. And so it doesn't belong to one entity. It's not governed by one entity. This is really about putting the participant first. And if we think about the participant as our key stakeholder, we all need to fight for their attention, and not in a cannibalistic way, in a how do we work together to really make sure that from the moment that person wakes up to the moment that person goes to bed in the evening, they feel they've had every ample opportunity to exercise their right to be active in a way that is relevant for them. So I do take a lot of heart for that novel partnership approach, because it means bringing in exactly what you see here, this diversity of representatives who you wouldn't intuitively associate with sport, physical activity, or recreation on the surface.
Thanks, Marco. I just want to drill down a little bit more into this, again, a theme here, which is common thread that you mentioned, which is the perspective of participants themselves. And again, it seems like the most obvious thing in some ways, listening to people and developing programs and allocating funding based on that is not happening enough. But in a more positive sense, perhaps you could share, if everyone could share like a specific example, Laura, you mentioned one before, like of something that's really worked well, when participants have been listened to, programs have been designed based on that, or funding has been allocated, according to that, and there's actually been change. Anyone want to weigh in on that? A story that maybe people here aren't familiar with.
I'll give a shout out to the Canadian Tire Jumpstart program here. Building more accessible playgrounds, for example, there's a few in my community. And what I mean by that is, we all can maybe remember what it was like to play and interact with other people when we were really young. And I mentioned earlier that, I had the experience of looking at others having fun and me wanting to play alongside them. And so I have seen more of and obviously this is also through the Ontario, accessibility program as well. But I would say there's more of an inclination to build community centers, playgrounds, common areas that encourage accessibility, that encourage people with disabilities to play. And I think seeing this, I'm noticing actually there's a greater benefit in, wow, kids are getting the experience of interacting with people that are different than them. That at least we perceive those as differences, when in reality, they're not really differences. That's been an important thing that I've noticed happen, whether it's here in Hamilton and, seeing accessible swings, but I do love the idea of supporting common areas that are adhering to these universal design principles. And then that's one of the major topics we did discuss during the panel. So I just shout out to Canadian Tire, because I think the Jumpstart program is an embodiment of a real need, common areas that are accessible for kids to play, no matter their abilities.
For sure.
On that, if I can, first of all, thank you, Joel. And I would concur. I mean, that was an example of how, we cultivated all kinds of partnerships, leaders in the physical activity for persons with disabilities landscape, the Rick Hansen Foundation, the Canadian Disabilities Participation Project, the Ability Center, you name it, Canucks Autism Network. We didn't approach this by ourselves by any stretch of the imagination. So all of those 6 principles that you see in the report, those, I mean, in hindsight, I can fit them in. That was the approach we took to really embarking on this program to help reduce the barriers to participation. And to this day, we continue with feedback from participants about how we can improve those experiences, whether it's on the physical assets like the playgrounds, or whether it's in the funding that we provide for mixed abilities programming, or whether it's in the capacity building resources that we've developed to help educate coaches about the realities of working with children and adults with disabilities. So I was going to use that example as well, but thank you, Joel, for the acknowledgement. It's particularly welcome when it comes from someone representing the Rick Hansen Foundation, given the work that we've done for the past several years.
Thanks, Mark. Anyone else? Again, thinking about the working backwards from the specific needs and perspectives and experience of participants. Any example? Anything else that you can think of? Again, make it more specific in terms of a great example of how that's been done. Iris.
One thing I'll add is that from a research perspective, I tend to run a lot of community-based programs with different population groups. So for instance, we ran a hiking program for cancer survivors last fall, before pandemic fall. And we found it to be a really great program. We saw reductions in anxiety. We saw really high adherence and people telling us through qualitative interviews that this was something they wouldn't have done on their own, that they really appreciated being with other cancer survivors, having the support. But what happens with research is there's no funding tied to continuity. So even if we come up with a program that we think is really beneficial, unfortunately, we kind of leave them lost at the end because it's very unlikely they'll continue into these programs without support. And we publish our paper and kind of go on our way. And that's really disappointing because we actually do learn really valuable lessons. So sort of thinking about how organizations that have the ability to run these programs can also connect with researchers who are testing programs and see, is this something we can now move forward with?
Thank you. Justin, any example you could share?
Yeah, no, thank you. Iris, you're winning the panel already. So there's that. I agree with Joel's comment on Canadian Tire Jumpstart. And I think we're all paneled out. We're tired of talking. We've all been working on this work for so long. But I think seeing leadership examples like CT stepping into a space that doesn't help their business, like making those investments when they started had no corporate value for them. And to see companies like Canadian Tire step up and make these investments when it's because it's what we need and it's what young people really rely on, I think is a great example to Joel's point. So I look at the individual example, Marco, that you're setting, but also just like with Patch bringing this group together, because if it wasn't for this deep cross-section and if it wasn't for the intersectional approach with, 6 different areas that all have to have change at the same time, like I wouldn't participate in this because we're just tired of talking about it and we need to get moving. No pun intended. A small example is like companies like ours. Like I work in pro sport where we have really rigid check boxes, and we've had a couple of kids who are transitioning, participating in our programs, and it's challenged our own thinking about what you have to check on a checkbox to play soccer, or to play hockey. And at the community level, us changing and evolving and listening to stakeholders around allowing a kid to just play sport in the way that they want to. And then the last thing I'll say is an opportunity for us to get better, because I represent sport, and sport, I'm like you, Joe, like high school gym sucked. I hated it. And we turn people off from physical activity. We have the power to get people motivated to move, but we also have the power to make it harder for them to want to. So I think, sport people like myself have to take this as an opportunity to listen more, to better understand the needs of the participant, the end user, and to change the way that we think about our rigid system as well.
I wanted to just go a little further on the role of sport here, and in particular leaders in the sports sector. And many of you are, David, Julie, you're accomplished athletes yourselves. And where is the role of Canada's, elite and other athletes in helping to create this more awareness around this?
I guess I'll just pick up on this. I think one of the things, and I can almost speak of this as, again, through personal experience, is I think we have to remember that your journey with sport as an athlete doesn't end, post athletic competition. I think one thing that I've identified is if you have competed in the Olympic or Paralympic Games, if you are a community leader in sport, a lot of that happens when you're in your 20s, maybe early 30s. I think it's an asset to keep athletes involved in NSOs. keep athletes involved as community leaders. And I think we have to make athletes who are transitioning from sport, we can't forget about them. And I think, we've heard over the last number of years, and I know, the Canadian Olympic and Paralympic Committee have worked together on better supporting athletes once they retire, because I think for many athletes, the transition from sport into, the corporate world or the nonprofit or public world can be a bit jarring. But I think if we can keep athletes involved in some form, and I know many athletes, obviously, I think we can all name a bunch who are still very involved in advocacy. Those things are super important, and I think we need to ensure athletes are given the right tools to continue to stay involved in inclusion and sport equity.
Mm-hmm. Thanks, Joel. We were going to get to questions at the end, but there's a couple of questions here. I just thought I'd jump into one right now because I think it's really important, and this is for you, Paul. The question is, do you believe physical activity services should be integrated as a part of Canada's healthcare system, similar to physio, massage, chiro, etc.? If yes, what is the greatest barrier to realizing this?
Great. Thanks for the question, Paul and Tammy. I think you posed the question actually, and so I guess my short answer would be yes. We should integrate, and it links to the question that you posed, Paul. That there are examples of where physical activity has been integrated into the healthcare system. If I think of groups of family physicians who might offer medical prescriptions for physical activity. Those prescriptions are linked to chains of community centers or commercial health facilities where people could actually go to affect their prescription or cash it in, like a pharmacy prescription. Those are great examples where people with a need, a condition, can interface with a medical practitioner and then actually access a real community facility to change the trajectory of their health. And it's additive or multiplicative compared to the other things that we might do, like give a prescription for a pill. The thing that I've said is you can make your pill twice as good by just taking it for a walk every day. So we need to make it an integral part. What are the barriers? It may come back to a bit of the training that more folks need to be aware on both sides. We need the systems to accept the whole kind of cascade. And it may also need kind of funding for our professionals. The kinesiologists and other exercise professionals need a role in our healthcare system that's recognized and funded. And it might need some social policy tools, like where is the tax benefit to join a gym or get active? We had it for a little while and then it was taken away. We need it for kids, we need it for adults, we need it across the continuum. So there's some opportunities for us, Paul.
It just makes me wonder, maybe there's a day when there's going to be an OHIP code for prescribing what you're saying. And another, in the conversation, there's an amazing example of a program called PARX, but PARX, which is a fantastic example. I believe it's to help healthcare professionals literally write prescriptions for people to get out in nature, which is a phenomenal idea. I wanted to drill down, folks, on another area that I in listening to the conversations earlier this year, I thought was particularly important. We haven't really talked about it too much today, which is starting early and the role of schools in this, and what the picture people painted of, in spite of schools doing their designated activities every day. The point that I found was most remarkable in listening to the participants was that there's a point of view that this physical activity is not a secondary activity to other learning. It's at the same level, but is currently far from that. And so it's indivisible, should be indivisible with learning in other subjects. Love your thoughts on why that's the case, and any thoughts on what we need to do to move the needle in that particularly important area.
Paul, if I may, I would take it a step further. And I think most would agree, and Justin and the team at MLSE actually have the example to show that activity is a predictor of learning. It's a driver of learning. So it's much more fundamental to a child's academic performance and participation than we actually give it credit. And again, not to speak for Justin and the great team that they have at MLSC Launchpad, but they've actually created a model that measures and evaluates the outcome from participation in sport, physical activity, and recreation in the school environment. And it's unequivocal. The data is very hard to refute.
Justin,
Yeah.
or anyone-
I was going to jump in on that. Right to Play very strongly believes in play-based learning, so that all learning should be, play should be the vehicle in which you allow that learning to happen. And the moments that people are playing, they're more open to conversations, they're more open to learning, they remember things better. And so instead of separating it, it shouldn't just be gym class. There should be physical activity and physical learning and games integrated into science. It should be in English. It should be in math. It should be in languages. It needs to be fully integrated in at all forums, and teachers need to be taught how to do it. And I think that that's a piece that as an industry we need to be looking at too, is how do we build the capacity within educators of different types as well. And knowledge of what physical literacy is, and how developmentally appropriate games can be integrated into different forms of learning.
Thanks, Laura. Well, I just also wondered if we could just spend a couple of minutes on the Indigenous perspective and experience in this area. And I think that this is a complex area anyway. You know, there's, as Marco and Paul were saying, there's all these different players. And in the Indigenous sector in Canada, in that space, some of the funding, policy, and decisions are completely separate than what's already not working. And whether that's health funding, education, other priorities are happening at a federal level in certain cases, rather than a more provincial or local level. So how is this playing out? I mean, it's clearly not working as well as it needs to, but perhaps you could just share a little more about that difference.
Yeah, of course. And I would say that there is currently kind of a revolution of thinking about physical activity within Indigenous spaces right now. I'll give a shout out to the Aboriginal Sports Circle and the sports circles, provincial sport and territorial sports circles across Canada are doing some really great work at not just thinking about sport, but thinking about physical activity and holistic health. But it's still a space that needs to be grown. And a huge part of it is that we have had our bodies talked about and our bodies weaponized against us for generations at this point. And so we're learning how to holistically reconnect with our bodies. And that means whole communities are learning the same thing. And you add on the layer of a lot of communities are small and remote and difficult to access. And so they don't have capacity, and that capacity might mean that you know, one youth worker in town is both the soccer coach, the broomball coach, but also the art teacher and the music teacher, and they're trying to do everything all at once. And that's a lot of different priorities to have. And so we need to be helping them and providing various different types of access and removing a lot of different barriers. And sometimes barriers in community really just looks like they have the knowledge, they have a hockey coach, they have no hockey equipment. So we might just need to help them get some hockey equipment. But sometimes that capacity building is a lot bigger than that too. And it's teaching someone who's never played hockey before how to teach hockey because their youth want it, and build their confidence to be able to do that. So there are a lot of groups that are trying to do it in different levels. But when you partner with Indigenous communities, it's so, so important that they direct and guide the conversation. In the past, partnerships have really been very fly in and fly out. And something I believe Ira said was, you know, it's not enough to have a pilot program. There needs to be consistent funding to do the thing afterwards. Same thing with Indigenous communities, is if you're going to partner with an Indigenous community, it needs to be sustainable. It can't be just for a moment. And that's something that right now, this resurgence and this revolution is starting to see communities demand more of that, and be able to articulate exactly what they need. But the funding isn't necessarily there, and there needs to be more funding, and ways to support communities that are smaller. Often people are looking at numbers. They're looking at how many kids they have. Well, if the community only has 20 kids in it total, they don't get any support. And that's not okay, because there's still a group of 20 kids that are going to be eventually adults who inspire the rest of the community to be active as well. So we need to start changing our metrics as well. It's a long answer. I could go on about it for hours and hours, but there are some pieces.
Well, I think that, yes, I mean, in the complexity of all this, this is obviously the beginning of a conversation, but I appreciate you saying that. But I also wanted to continue on something that you said a number of times, which is funding.
Yeah.
And we haven't really talked about that today so far. And clearly there's a lot of coordination that needs to happen on the ground, that we have to be listening to people more, but it's also, it's a question of money too.
Yeah.
And there are things recently that there's the announcement of the new $80 million fund for, I think, community sport, which seems like a good start. But I would ask you, given that the situation seems to be so clear, and the picture you all have painted is very, very clear. People were not listening. People are not active enough. There's not enough, focus on people with lived experience and working backwards from the needs of participants. And there's not enough happening in school. All these pieces, and a lot of these, as you just said, Laura, there is a funding. They don't have the funding for whatever is needed. So I'm going to ask you, like, if each of you were talking to a potential funder at a government level, like, what is the story that they are not getting that you would be telling them to convince them that more is needed? Anybody want to jump? Paul or Iris?
Sorry, go ahead, Paul.
So for me, maybe if I take the healthcare angle or policy angle, I guess it's figuring out what's the relevant conversation of the day that will drive a policy change around funding. And you're right that funding for physical activity itself may not be the most attractive thing in the moment, versus something like pandemic response, or how do we deal with crises in youth mental health, or chronic disease burdens. So it's finding the solution to match the agenda. And we do this in healthcare all the time. What is it, the thing that we need to curb? Is it hallway medicine? Is it something else? And it's how physical activity might fit into that agenda. If this example was education, we need more physical activity in schools, but no one wants to listen to that story. Is it that we need more effective learning? And that's what we're about, building better curricula. And by the way, if you had all your kids be active every day, they would learn better and achieve better outcomes. Then that's the agenda that we need to tack onto. It's a tactical one, unfortunately, and we do it in healthcare as well. How do you reduce the burden of illness in hospitals? Well, you get people being well in the community, so they don't end up in hospitals. Don't build more beds, keep people well at home. So it's kind of tapping into those sorts of stories, Paul. So we need to do some very deliberate reconnaissance to figure out what the pressure buttons are in the moment. Iris, I'll turn to you.
Thanks, Paul. You talked a lot about primary prevention, keeping people well and out of the hospital setting. I would also argue that if we were going to target funders, we really need to tell the story of what happens to people who end up in the hospital setting and are now out of it. The two groups that I tend to focus on are cancer survivors and doing work with postpartum women. What those two groups have in common are high levels of anxiety and depression that can be remedied by an improvement in physical activity, but a complete lack of support from the healthcare setting. So we do a really good job of making sure that when cancer patients are going through oncology treatment, that they're well attended to. But once they're done their treatment, once they're kind of back in the world, we don't do a very good job of making sure that they can be as well as possible, that we're delivering proper programming that's suitable to their needs. Same thing with postpartum women. We do a great job of making sure our moms and babies are really, really good until about 6 weeks postpartum, and then we say good luck. And there's a lot more work that can be done to provide those specialty programs to make sure that we give them the opportunity to be well more long term. And those are just two examples of groups. There's many, many more that we could also look at that same concept of once you're out of the healthcare setting, how can we support you?
Thank you. Amanda.
Thanks. So we talk about this a lot at Diabetes Canada in terms of prevention, and the issue around our healthcare system is an illness model versus a wellness model. And the challenge, it's about short-term pain for the public payer versus long-term gain. If we have the short-term cost commitment to wellness programs, healthy behavior programs, for people with type 1 diabetes, having access to devices that help them manage their health better, we have a subsequent cost savings long-term down the road in terms of reductions in hospitalizations, emergency room visits, and the overall healthcare system needing it as much because we have that wellness model where we've committed to it. But the challenge, from following up on what Paul was saying around the policy side, is a lot of this is outside of the healthcare system who are making the decisions. If you're looking at the built environment and infrastructure, that's municipal initiatives that are not necessarily talking to the healthcare providers and the healthcare policy people in terms of making sure that we are having a preventative model to help people live healthier lives.
Thanks.
I'll just jump in on what Amanda said, because I think it's resonated with me that, we've talked a little bit about disabilities here on this call. And if we're to look at the Canadian population right now, of working age Canadians with disabilities, 40% of them are unemployed, which means many of them don't have access to employer benefits. I can speak at length of the impact of those benefits on my well-being, whether it's to go to regular physiotherapy appointments, getting different medical devices for my wheelchair. The assisted devices program here in Ontario can't cover everything that you might need as someone with a disability. So I think if I'm to say, how can organizations get involved in these things? We need to make sure that people with disabilities are getting jobs, getting access to resources where they can use it towards their health, because I think that's the most prescient issue facing people with disabilities is health equity. It's the basis of why I got involved in this discussion. And I think that's the bigger topic that I hope that more organizations can address, because group benefits, employer benefits, huge. And I think if you're looking at a Canadian workforce right now that has faced public health measures, is facing anxieties, facing all these issues, we have many Canadian workers that have declined in their physical well-being. So I think organizations can simply address that gap by making sure that their employees are feeling healthy and are able to access benefits, wellness spending accounts, things like that. I think that can actually make a huge impact.
Thanks, Joel. Marco, you're
yeah, absolutely. So the conversation around important outcomes attached to absolutely important. As we all know on the call, it's difficult sometimes to have that resonate with some of our decision makers. And I would say an important piece that we need to take into consideration is actually measuring the economic contribution of this work. And it hasn't been done in decades. The only example I can point to is a collective in the Calgary area known as the Active City Collective. which quantified the economic contribution of Calgary's Calgary's active economy. They took a very comprehensive look at that. They looked at certainly sport participation. They looked at all the corollary activity like retail, dining, entertainment, all of it. They looked at all of it. And despite its challenges, despite all the disparities that we've been talking about today so far, they quantified that the economic activity directly attributable to participation in the Calgary area amounts to $5 billion a year. If you were to aggregate that on a national level, it would be hundreds of billions of dollars of economic activity. And this isn't about saving healthcare costs. These are immediate economic, this is immediate economic activity. Hundreds of billions of dollars nationally. That's a significant part of our GDP to be ignored at our peril if we don't want to address all of these disparities that we're talking about today. So if the outcomes don't appeal to our decision makers, the financial argument certainly should appeal to our decision makers, because that's all at risk of crumbling, particularly with all the impact that COVID has had on the sport, physical activity, and recreation landscape across Canada.
Mm-hmm. Thank you for saying that. And and the investment to make that happen, as we know, is relatively speaking very, very small. I was also reading, I have to dig it up somewhere. There's a study at the University of Sheffield in the UK. It's not the economic impact, but it is the impact on other social conditions, like the value of physical activity on reduced family violence, the value of physical activity on reduced levels of incarceration. There's all these other indicators as well, which we should share back. I'm not sure if it's in the report, but it was super interesting.
I wanted to jump in on the financial side of things. I want to speak from the program side. So what we know is that there's a lot of good programs out there. There's a ton of good programs, and we actually just did an environmental scan of youth leadership programs. And what we found was so many good programs were shut down. They're no longer running. And something I would like funders to think about is that we have communities saying programs are working and they need to keep going. But oftentimes funders want new shiny things. They want you to develop something new. They want you to pilot something. They want to create something special. Oftentimes programs just need some core funding so that they can run consistent, accessible, free to access programming. And added to that, funders also have a tendency to, and the government is part of this, want numbers. And I agree with Marco that data on outcomes is important, but I think we can't only judge success based off of how many kids or how many people are participating. Because the reality is that people who have experienced marginalization are going to be smaller numbers in physical activity and programming right now. And hopefully that grows over years, but if we're judging if a program is successful, if only 10 BIPOC people show up, that's 10 more than maybe would have showed up a year ago. So yay, success. But oftentimes funders are like, 10 is not a good number. We wanted 100. And so that they turn to different programs that are touching different groups of kids or whatever. So a little bit of like consistent programming, sustainable programming is something needed right now. And also just watch how we view numbers and success.
Just the qualitative side of it. Yeah, Dr. Paul.
Hey, Paul, thanks. I want to call out a comment made in the chat box by one of our wonderful colleagues, Jonathan Fowles, that speaks back to the notion of the importance of health behaviors and what we do to promote and fund health behaviors in a positive way, that a vast minority of funding goes towards prevention, including programs for physical activity. To your point, Paul, that a little bit of investment actually has a huge benefit because the vast majority of healthcare spend is on chronic diseases. And that's where we kind of focus on at the back end rather than at the front. So small investment, big outcomes, and these are long-term sustainable investments that we need to make to Laura's point, but well worthwhile. So there's not only the economic business impacts, but also the health ones that we need to put out there.
Thank you. Any other, Justin, your thoughts on funding?
I'm struggling with this. Everything that everyone said, I agree with. I just don't think anyone cares, to be real. I think these things take a decade, and election cycles don't last that long. And to be real, I'm just ready to run with the runners. I think we got to start figuring out who wants to be at the party, invite them, and let's start going. Because we're always trying to convince people of the value of physical activity. And we're preaching to the choir, even the people who are going to be on this call listening. Like we all get this, we all agree. So I think, you know, us coming together is really, really important. Laura, your points heard, you know, loud and clear. We are a funder too. So funders, we need to hear this, and we need to step up, you know, with a consolidated approach of how we can start to tackle some of these issues, because us just waiting is tough. The earlier comments about the school system, like I agree, and it's hard for me because I always look at it, and we always put the pressure back on the marginalized person. So the youth who's in that classroom, or the teacher who's overwhelmed in that classroom. And like we need more adults in the classroom. All of us who have kids who are, you know, getting schooled at home can see a little glimpse into the life of our teachers, you know. And we need to be in the school to support them, to give them that 15-minute physical activity break so they can just like catch their breath. Because we're also going to end up asking teachers to be experts in everything. And we got to rethink how we show up as sport people and physical activity experts, and not necessarily like be on the sidelines and telling other people what to do, but us being like, we're here to join you and come into your classroom with you. And let's just start going. If there are school boards who want to be part of it, let us partner. Let us work together and figure it out, and stop worrying about the math system, because I think we'll be worrying for a long time.
Well, you segue into the question I was going to ask you anyway, and everyone, which is, so we're ready to go. All of you participated, of course, and contributed to Change for Good Health. You're already on the front lines of this important work. But are there things that, you know, as a result of participating in this initiative, that are making you think differently about what you are doing in your own organizations and how that might change?
I think probably collaboration for all of us. I think everyone on this is doing great work. How we continue to, you know, communicate, be open-minded about working together. None of us are motivated by us looking good. And I think that's the best starting point, and us figuring out what our roles are. Our organization needs to step up. We're very, very aware of that. Our influence in society, our influence, especially with a playoff run, right? Our influence to get young people behind this, our influence with, you know, the adults and teachers. And so we're at the table and happy to collaborate. And I think that's the big thing for our learning, is we have to be at the table. We can't just stay in the pro sport world and just not pay attention to what's happening in our communities.
Amanda, how about diabetes? What do you see as changing there?
Sorry about that. I was just working from home, people in the room. So I was just going off camera to say, it's okay, you can come in, don't worry. So there might be a little bit of noise in the background. So absolutely, we absolutely agree. Collaboration is important. I mean, we're a health charity, so we run a lean operation, and we rely a lot on volunteers to help us with advocacy and initiatives. And so much is key around prevention and ensuring that, you know, we can help people to, I can't remember who mentioned, I think Justin mentioned about not putting the onus on the marginalized person to do everything themselves, but, you know, have the experts, the healthcare providers, the physical activity, fitness professional providers be engaged to help get people where they need to be. So it's not just, here's another thing you need to add to your to-do list today. And if I could share a story, I was thinking about all the talk around helping in schools. And before I joined Diabetes Canada, I was a fitness professional. I had my own mobile fitness business for 10 years. And shortly after I started it, my daughter was diagnosed with type 1 diabetes, 8 years old, in the school, needed to help out, but didn't want to be on top of the teacher. And so I thought, well, I'm a fitness professional and the kids are lacking daily physical activity. They didn't have gym every single day. They had DPA, daily physical activity, and depended on the knowledge and comfort level of the teacher, what they were doing with them. So I started volunteering in a number of different classes in the elementary school to go around and deliver the 15, 20-minute physical activity segments to give the teachers a break and to give the kids another adult in the room who could, who gave them a different perspective. And so, big important factor there in terms of volunteerism and getting people to help us as our different organizations come together. But I can tell you that one of the best classes was a class of grade 2 and 3, all boys, with a number of, I think half the class had individualized education plans, which meant they needed extra help. There were specific issues, developmental or whatnot. And every single time I went to that class, they were focused, they were engaged. I no speaking out, no acting up. And every time I was there, the teacher said right after I left, she did math with them because they were really good at math. They weren't disruptive, they were focused, they knew what they were doing. And it showed that the physical activity helped with the education side at school.
Thank you. I'm just conscious of the time. I want to get to more questions from anyone else who's participating here, but is there anyone else who wanted to share anything about their specific changes at your organization as a result of this? What do you see being different?
We have so many workshops. We have, for years, we've been developing workshops specifically for youth workers on how to run physical activity, play-based learning, do it with a trauma-informed lens, consider mental health, build resiliency in youth. I want to figure out how to get these out into the world more. So if anyone is out there who wants workshops, this is what my goal is at this point. We've also just started, we did our very first open source resource, which is a resource that anyone can access. We're not keeping intellectual property over it. We're sending it out into the world. I want to do more of that. The more I'm hearing of it, the more, if we have resources, that's what I want to send out into the world. And I think I'm going to dedicate some time to that and making sure that we're connecting with the folks here and others to do it.
Well, I know we've got an amazing network here. I'm sure we can get it out to a gazillion people, these things. Iris, I think, did you have your hand up?
Yeah, I was just going to add on, we talked about this a bit at the panel earlier on in the winter, but really COVID allowing us to refocus on where physical activity can take place. You mentioned the PARX program, Prescription for Nature. We're already kind of moving in the direction of recognizing that being physically active outdoors is better for mental health. It's more accessible. We need to make that more relatable and culturally appropriate. But I think COVID has really sort of pushed the agenda on focusing on moving that shift of physical activity done elsewhere, done in nature, using your own backyard.
Thank you. Paul?
The other thing that strikes me, Paul, is the power of conversations that there's so many wonderful ideas that are shared in a group that normally doesn't come together. As an academic, I've got my network of people. They're the same people, very smart people, but this is such a richer conversation when you get to folks that you don't interact with on a regular basis. So perhaps a learning for me is to think broader in terms of networks. But one thing that I would hope for around the notion of connections is opportunities for these kind of broader engagements, which are incredibly powerful and would really help work moving forward.
Thank you. Marco?
Sorry, was that Marco? Paul,
Yes.
you're calling on me? Put me on the spot there at the end. Okay. Look, it's been said from our perspective, you know, we are a national funder, so we have at any given time, you know, we're supporting somewhere close to 1,000 to 1,200 organizations in a normal year. And one of the things that we've started to do more diligently is really listening to the nuance and some of the information that our grant recipients are feeding back to us in terms of the capacity gaps and resource gaps that they have. And we're trying to respond more nimbly to those gaps. So whether it's providing financial supports or other supports, we're trying to really dig a lot deeper in our preconceived notions of how we can help organizations at the grassroots level. There's no, you know, that's a very blanket statement. The reality is we've got 289 geographic regions across the country that we treat as chapters that we use as a launch pad to this hyper-local focus in what we do. And it's taught us a lot of lessons about how different the needs are in various parts of the country. A solution for an Indigenous community in British Columbia, for example, may not be relevant for an Indigenous community in Northern Ontario. And we are acutely aware of that. So we try to take a very, very hyper-local approach to the work we do. It's much more resource intensive, but it leads to so much better outcomes in terms of, you know, the dismantling of the known barriers to participation in those parts of the country.
Thank you. Thanks, Marco. Joel.
Sorry, I'll just unmute myself. I think the bigger picture is what kind of country do we want to live in? That's, you know, I firmly, you know, I think, you know, growing up, firmly had the belief that, you know, Canada was equitable, that we, you know, promoted fairness. I think there's been a broader discussion about racism, about socioeconomic factors that do cut off many Canadians from participating in activities geared towards sport. And so if we are to assess how Canada is as a nation, we need to also ensure that we're looking after the most vulnerable among us. And I remember, I can't remember who I mentioned this with. I think it was our former Lieutenant Governor, David Onley. But I always had the belief that you can always assess a country based on how it treats its most vulnerable citizens. And if we are leaving a huge gap here among aging Canadians, among Canadians in Indigenous communities, among people with disabilities, then that does say a lot about our country. And the country that I want to live in is the one that does promote fairness and equity. And it has to start with health, because that's at its fundamental core, a human right. And if we're not promoting that, what does that say about our nation? And so I would start with that.
Well, thank you. And Joel, you know, what you said takes me back to the first conversation I had with Patch, which was exactly about this. And Patch, I'm going to turn it over to you for a second, because you've been listening to all this, and this is where it all started. What Joel said is actually where it all started. Your thoughts?
Patch, you're on mute, just so you know.
If we're going to be a country of equality, then it can't be that when there's a crisis like COVID, the rich get to exercise. You know, it's got to be all the activities that currently exist for exercise. We know there could be more, but all the ones that currently exist, let's adapt how we do it safely. But let's continue to allow people to enrich their hearts and their minds and their bodies simultaneously. To deny that opportunity is going to fill up the clinics at the hospitals. It's going to fill up the clinics of mental health conditions. It's going to deny the fun, the social ability of everyone from senior hockey players to junior hockey players. You know, everyone suffers when we take away the ability to access physical health. I'm not saying make anybody exercise, and I agree with we can enrich people like your parents from Guyana, why it would help them. You know, My mother's 101. She grew up on a farm, and sometimes she wonders, what's about this exercise stuff? You know, and milking the cows was enough, right? But everyone deserves to pursue getting active if they want to. And we've taken it away. And there are ways to do it safely. If we can shop safely, surely we can exercise safely. And we're, as someone said, we're all on the same team. And I think we do what Justin said, is we stop, you know, waiting for someone else to do it, we do it. You know, that's why this collaboration is so powerful. From Marco's 200 plus connections in different communities, the stuff that Right to Play has been doing, you know, taking the medical models and making people realize that if you don't look after your health, you'll be looking after your sickness. We're on the right path, and we got to turn it the other way around. If you don't allow people the freedom to exercise safely, then you're taking away their ability for health and well-being. You know, that the whole purpose of being safe was, we thought it was short term. Well, if 15 months of activity, if you're on the space station, they have special programs for you to come back. What's the special program we're doing for all the people who have been locked up in their apartment? Especially, you know, the multi-story apartments with a lot of people in them, because they're perhaps first generation, right? You know, who's looking after those people who, by the way, are the more frontline than anybody? You know, so we have to be fair. We have to be equitable. And it can't be that people with a private bike at home are the only ones that get to exercise and come out of this, you know, healthier than ever. Well, that shouldn't be the way it is. It should be that everyone gets treated equally, you know, and our rights, the essential right to be able to pursue physical activity if you want to, should not be taken away. There are gymnasiums and tennis courts, indoor and outdoor, and stuff across the country where people can be 20 feet from each other, and we can have around the clock exercise. You know, and it can be in an Indigenous community in northern Manitoba, it can be out in the Rock, it can be anywhere, it can be downtown Toronto, right? You know, we can find a way to do this, and we can tell if the government people don't want to help us, and we can tell them to get out of our way.
Well, Patch, one of the things that you said, which always comes back to me, is we have a health care system. We don't have a health system. We need a health system. I mean, funding. We have funding for a health care system. We need funding for a health system, and that's obviously needed more than ever. So I just wanted to, speaking of taking action.
So I don't think we need funding. I think, you know, what we need is freedom to do what everyone was doing already. And all the stuff we've talked about, we can make that freedom more appreciated and more accessible and more equitable, but stop taking it away from people that are willing to do it.
I'm going to jump in. We're coming to the end of our time. I know Laura had a quick question for Dr. O related to what Patch just said. Laura, do you want?
So I have a question. So back in the day, I was a swim coach, which was great fun. But something that we found was that we had to, the municipality who's in charge of recreation needed to make money. So they would charge us a lot too, and they increased the charges on the pool, which meant we increased our charges to our membership. So in terms of how governments can work together, recreation sits with municipalities, health sits with provinces, and sort of sits with the federal government. So I think that there is something to be said about they need to get on board, like governments need to get on board. But how would you see that working in terms of things like doctors prescribing recreation?
So great points, and certainly collaboration across multiple levels of government are always really important to get any programs going. You know, theoretically, this could fall under kind of municipal public health as well as an initiative. So alignment is critically important. I think if we have a shared goal, I think that's where we start with, as opposed to whose jurisdiction is it? It's rather than this is something that we all believe in, and being active, having kids swim is a marvelous idea that's COVID safe. Lots of chlorine there, Patch. It'll get rid of the virus. You know, I love the ideas of just saying this is where we need to get people active and stay well. What needs to be true for this to happen? And I think sometimes we focus too much on what's different as opposed to what we have in common to actually move to a solution that's quite credible.
Holly, I'm going to turn it over to you to wrap us up. Thank you, Paul. I just want to say one thing. Thank you to everybody here, all of our guests and all the participants, and to say that Change for Good Health this is the beginning. So there's a lot of things we don't know about where it's going to go, but everyone here is committed to taking action, which is the most important thing. And I can tell you that we're going to be thinking about all of what has been said here today, incorporating it into the findings that we already have, and bringing that forward to the next session that we're going to have in June with all the participants from before. So it's just the beginning. So thank you, everyone. Holly, please.
Thanks so much. Yeah, I just listening. The quotes of the day were. Oh, sorry. Yeah.
Just before you close, I want to thank everyone for having the courage to be on this, because change takes courage, and there's different ways to show courage, and you're all showing courage. So thank you. Go ahead, Holly.
That's awesome. Yeah, no, the quotes of the day were making your pill twice as good by taking it for a walk. Dr. O gets one award for that. And I think based on the discussions, it's time for us now to collaborate and find ways to make connections. And it's, as Justin said, it's time to run with the runners. I wanted to say we're going to be sending out a link to the discussion paper, and we've been posting that in the chat through the discussion today. But obviously a discussion paper is just the beginning, and the world has many of those, but we hope you like the one we came up with. And we do invite you to contact Impact if you're interested in getting involved in Change for Good Health. The participants and obviously you're here already, but those who are listening. And if you're interested in speaking more with the panel members, we'd be happy to put you in touch with them. We really appreciate your interest and enthusiasm, and I think that together we can work to make physical activity part of pandemic recovery. So let's kickstart this effort, and I really appreciate your help, and we'll be back in touch soon. Enjoy the rest of your day.
Thanks, Holly. Thank you, everybody.
Thanks very much.